Greetings everybody. My name is Tawfig. I'm assistant professor at Rock College of Dental Sciences. Today I'm going to present my poster entitled Antibiotic versus Probiotics in Periodontal Therapy. Periodontal disease is inflammatory condition that provoke a response to periodontal pathogen in the biofilm of the subgingival plaque. It affects the tooth supporting structure and it might lead to tooth loss. Periodontal disease also has impact on the systemic health. It can be considered as a risk factor for cardiovascular disease, preterm low birth baby, and also it can be considered as one of the factors that can increase the level of glucose in diabetic patients. The gold standard for the treatment of periodontal disease is by scaling a root planning, and systemic antibiotics sometimes indicated, and the indication of systemic antibiotic in order to get rid of the microorganisms that inaccessible to be eliminated by the mechanical means. Also, systemic antibiotics can be used in case of acute gingival infection with systemic manifestation. Nowadays, antimicrobial resistance forms a great threat to humanity, and it evenly can be balanced by terrorism and climate change. So, in order to reduce the antimicrobial resistance, which is considered as a life-threatening condition, the use of probiotics arise. Probiotics are considered as bacteria with physiological benefits for humans. They influence both development and stability of microbiota. Probiotics administered orally and may benefit oral health by preventing the growth of harmful bacteria and modulating mucosal immunity in the oral cavity. As you can see in the figure that prepared by my colleague in this poster, Dr. Rasha Abul Qasim, you can see on your left side the tooth with periodontal destruction and biofilm, that the bacteria within biofilm that causes periodontal destruction. For getting rid of this bacteria, you go for phase 1 therapy, which is scaling a root planning. Two options are there. The first one is to respond to this and to heal. The other option is to not respond to the mechanical means alone. So you can go for adjunctive antibiotics such as metronidazole, ciprofloxacin, amoxicillin, clindamycin, and augmentin, also one of the antibiotics that can be used. In order to decrease the antimicrobial resistance, we go for probiotics, lactobacillus, and bifidobacterium. So those bacteria which we use as probiotics can reduce pH, act as antioxidant and anti-inflammatory, and it also decrease the amount of bacteria in tongue, and one of the other things that is decrease the amount of volatile sulfur compounds that cause halitosis in periodontitis. So the use of probiotics has re-emerged as a means to restore and boost beneficial microbes in the oral cavity. Timing of growing interest in this field coincides with the need to augment or replace antibiotics whose side effects are undesirable and whose efficacy is administered due to drug is diminished or decreased due to drug resistance. So, in order to avoid the deleterious side effects of antibiotics, administration of beneficial bacteria in form of probiotics can be a valuable alternative in the treatment of periodontitis. Thank you very much. I hope this poster is informative and the information within it is useful.